So yeah, so we're gonna get started. We're gonna do our little housekeeping part to begin with, just to remind you, and want to make sure that you have my email to contact me. Best way to get a hold of me. Here we go. And Haley's the driver tonight as far as the slides and everything. I'm just backseat driver, so to speak. And so we'll do the housekeeping stuff first. And then I've got a couple of slides, 6 or 8 slides on longevity I'm going to share with you. Then we'll have our Q&A. And like I said, we won't stop until we drop, until all the questions are answered. And if you've got questions that arise in the middle of things, please feel free to submit them by chat, or raise your hand. And and then at the end, after the questions are over, if you want to stay, we'll talk about some products that I would recommend that you can find on my website to help with longevity. But I'm kind of a soft sell guy. I hate being marketed to, and I just want to treat you the way I'd like to be treated. So, if you want to stay, that's great. If you don't, that's fine too. And I think we've got some sort of a discount code tonight too, as we have had one. Haley does such a good job that I don't even, I forget to ask her all these little details because she's a detail person. I'm kind of the visionary, the big picture person. So yeah, let's go. We've got 604, 605. We've got 32, maybe 30 real participants here. That's great. That's a great number to have. And so, yeah, so I want to say, so tonight we have questions from email, and again, you can submit them in the chat, or you can raise your hand, especially if there's something I'm saying that you don't get. I think it's important to get it, before I move on. I wanted to show you this. This is probably the best email to reach me at. It's through the website, but it goes directly to my phone and to my phone and my all of my computers, all my devices. Um, and we're not going to finish until we're done. And we'll also need to let you know that in spite of my medical expertise, I really, need you to know that I'm not giving you directly medical advice for your animal. We don't really have that kind of doctor-patient relationship, at least not yet. And I don't want to give you the wrong advice, but I'll do my best to give you educational information that can help you. And you can also reach out to me by email and we can, you know, talk about things a bit more there. I have a lot of incoming email every day. Please be patient with me. And this is not my only job. I work for this mushroom company, Real Mushrooms, and they keep me very busy too. I do my best. I try to have some work-life balance and some personal time as well, whatever person, I don't know quite what that is, but I've heard it's pretty good if you can find it. Um, and yeah, so again, like we said, we're offering these Q&As pretty much the fourth Thursday of each month, pretty much to follow the third Thursday of each month when I'm doing the Q&A for Real Mushrooms, and you're certainly invited to attend those. We can get you set up with invites or send you to the right place to go to do that. If you're in social media, Real Mushrooms has a social media page for pets, and that's where you can also get this information about their lives. And we're recording them, and so we will post the recorded video once we get it all processed. And I also want to make sure that we are um, giving you these slides that we're doing as well. I think, especially last month, or was it last month when we did epilepsy? I think there's a lot of good information there. And if you didn't get those slides and want them, let us know. We will get them out to you. And let's see. Then my book is a great reference work, and if you don't have it already and want to get it, you can order it through Amazon. And if you send us the receipt from Amazon, we're happy to give you a little discount coupon for 2 times for 25% for anything on our website. That could be quite worthwhile. And six, I changed the number six. We'd like your feedback. Let us know, might we do anything right, do anything wrong? Want to know, want to make it better. What topics in the future are, just burning topics that you'd like us to cover, and I will. And I'm also looking at maybe bringing in some guests. I'd like to talk about some of the other types of ways that we can help your pets, like with animal massage. I have a massage therapist. She's not on tonight, but she has been on past ones that comes on a regular basis to massage Ollie, who's got a lot of issues. He's a rescue dog. And I've just recently connected with another massage therapist in Denver who I was thinking about maybe having both of them come, and that would be kind of lively. Also, I've got an animal communicator in Oregon I've worked with for 30 years that I think is pretty interesting, and I think could be a pretty interesting conversation. And she's agreed to come here. And, there's all sorts of pet nutritionists. We want to talk about diets at some point in time. I think diet and food is the first place to begin with your pet in terms of trying to create a healthy life for them. So yeah, just let us know, and reach out to me by my email or by with Haley or whatever. I keep thinking Haley's driving. I keep thinking I'm doing something here. So let's move on to the next slide, Haley, and we're talking about longevity strategies. And like I said, everybody wants to live forever. Our pets don't live long enough. Everyone agrees to that. We're not billionaires, but I think there are some very cost-effective ways that we can enhance longevity. Now, when you talk about longevity, let me just kind of define a few things. Really, you don't want to live a really long time if you've got a terribly painful, debilitating disease. I certainly wouldn't. And so when we're talking about longevity, we're really talking about what they call health span. This is the period of your life or your animal's life when they're healthy, in optimal health, and living life well. And so this new term of longevity that's gotten so popular. No, don't not yet, not yet. Um, there's this new term of longevity that's gotten so popular. Really, it's a rehashing of a word we've been using for years, which is wellness. These are wellness strategies. Optimal wellness is health span. So it's not like I'm really telling you, I'm not really creating anything new. I'm just kind of reworking it with a new label. So let's go to the next slide, Haley, please. And the path to health is goes through a number of different um, stops that are important to establish and maintain and create health in your animal. And I will tell you that these strategies I'm talking about would serve you well as well. I mean, if we're going to care for it, it's kind of like when you're on the airplane, and they say, when those oxygen masks drop, put it on yourself first before you put it on your child. And really, these are strategies that we also want to live long, so we can care for our pets for a long period of time as well. So these serve you well. Now, I'm not going to recommend that you eat a raw diet unless we're talking sushi, but so um, I tend to digress. So in my mind, the very first thing that you want to change or to improve or maintain, if you've already gotten it working pretty well, is the diet. The diet is very important. Now, there's a lot of information out there from a lot of animal influencers and veterinarians and companies about a jillion different types of diets, all the way from the commercial processed foods to raw diets to diets that are parts of animals, or roadkill. I mean, there's a lot of different ways to feed your animal, and I don't think there is any one single way that is ideal because one, it has a lot to do with yourself and what you have access to. It has a lot to do with how much time you have in your life. If you're busy working all the time to earn enough money to buy the food for your pet, you may not have enough time to do the preparation, although there are ways of simplifying it. And I am in the process of putting together a little video, actually not so little, but a little video description of me making a diet for Ollie because I feed Ollie basically a home prepared meal um, from scratch every day. I just feed him once a day, and that's something to think about: is how often do you feed? And some studies show that doing some limited fasting can actually prolong life, as well as being sure that the animal isn't overweight. There was a study they did in Labradors where they fed them 25% less than what they should be eating, and they lived 2 years longer than the labs that were allowed to eat as much as they wanted to and enjoyed life but didn't live it as long. So the best diet for your animals' health and also the best diet for your lifestyle and for your budget. Those are all important considerations. And if the easiest and best diet is a kibble, which is not the best of foods to feed in spite of what becoming the standard model for feeding, then there may be things that you can add to the kibble to make it healthier, fish oil and some greens and things like that. And if you eat well yourself, then it may be possible to take the very same foods that you're feeding yourself and give them to your animal in the appropriate proportions. And that's something that I have done quite a bit when I was in practice, and it's something I plan on including into this kind of video description about diet. So I'm going to do it in my kitchen. It should be kind of cool. I'm learning how to do this video stuff. It's kind of, I'm an old timer. It's new for me. But anyway, and then activity, exercise, fresh air, clean water. These are important considerations. And in our busy lifestyle, in our urban lifestyle, in our cloistered lifestyle inside apartments, daily exercise, is something that we have to take time to do for ourselves as well as for our pet. I mean, walking with your pet is great for yourself. So, again, this is something to think about, but don't do it too much. I mean, in the sense that, some people think, well, my dog really is limping, but he really likes to follow me, so I'm just going to keep going far. But that doesn't allow them to heal. Fresh air, clean water, our world is changing and those aren't as common anymore. And changes in regulations as far as, environmental pollution and things, are not going to make things better. So, that's something to be aware of. And then, our animals are, our little selves, our little others. And so they're very much dialed in to the emotions in their environment, in our household. And so, again, heal yourself. If emotionally things are in your household not that balanced, see what you can do because your pet will also feel those same stresses. And for those of us, especially many people who do work and live in apartments, and have animals that need exercise, they're confined to the apartment, to a small space for long periods of time when their instinctual needs are to roam and sniff and travel and pee on bushes and things instead of peeing on your couch. And so these days we're talking about emotional enrichment, which is a way, environmental enrichment, sorry, which is a way of making things interesting for your dog. For instance, instead of just plunking the food bowl down there for your dog the 2 times a day it eats, or putting the food down, then leaving to go to your job, some people will actually hide, the food in a variety of different places in the household, and the dog sees it as a game when you go, and that also helps with separation anxiety because they're focused on playing the game to find the food, little Kongs that have peanut butter in it or some of their kibble or some of their food. So there's a lot of things that we can do to make life better for our pets and for ourselves. And the last is the appropriate supplements. Now, this is my wheelhouse. This is what I'm good about. And we want to make sure that they're appropriate for your individual pet. But you'll notice I put them last. I think they're very important, but I think these other considerations are even more important. So, next slide. So some of these, and so the next slide is about these supplements, and we're going to talk a little bit about each of these, but I do want to leave plenty of time for questions. And so antioxidants, we are probably the most common type of supplement we hear about, and they're real. The need for them is real because our bodies, just our metabolism of our bodies normally, without any kind of outside stress, creates these free radicals. What are free radicals? Well, they're not like something from the 60s or maybe from current day stuff, that you're reading on the news. But free radicals are these ionic charges, these charged molecules, these charged atoms that float around and can damage tissue. And there's a lot of studies that show that these free radicals, if they're not controlled, contribute to the aging process and contribute to deteriorating organ function. And our body has natural antioxidants, which work pretty well if we're healthy, but oftentimes the stressors of more free radicals that come in from the environment, from the atmosphere, from the water, from the food. Maybe there's toxins or preservatives in the food or Roundup residuals in the food. They all create the need for using these antioxidants. And there's many really simple, not expensive antioxidants that we could use. Now, the best antioxidants are not the ones like vitamin C or vitamin E. Those are more like pharmaceutical antioxidants. The best antioxidants come in food. It's just like we learn, you should be eating foods that are brightly colored, fruits and vegetables, because the colors actually are the antioxidants. Cranberry is probably one of the most widely available, acceptable, inexpensive antioxidant around. And not only is it good, we think about it for urinary tracts, and not only is it good for urinary tract stuff, which it is, but it's also just a great antioxidant as well. Inexpensive, and you could get dried cranberries, organic dried cranberries, and feed them to your animal. You can get fresh cranberries, you can get cranberry juice, you can get freeze-dried cranberries and cranberry. I mean, it comes in so many different varieties, very easy to find, very easy to use, and most animals like it, depending on how sour it is, how tart it is. Some dogs and especially some cats don't like that tart taste. So, but there are other good antioxidants out there to look at that come from whole foods. Now, turmeric, we hear a lot about turmeric. Turmeric's got great antioxidative properties as well as other good properties. And you can cook with turmeric. You can get it as the culinary herb. If you're fixing it, and you can spice your dog's food just with the culinary herb as probably the least expensive, but you have to use quite a bit of the herb because it's not as bioavailable as some of the supplements that they've done some special manipulations to make it more bioavailable. Um, and we want to do something that's going to support the microbiome. We're learning more and more about the microbiome and how global it is and its value. I'm taking a course now on microbiome therapies, and once I get a little smarter about it, I'll be probably doing a section on the microbiome as well, and what things we can do as far as diets and supplements, and what kind of successes we see with certain kinds of diseases, and how we can address that. And I'll start to carry some microbiome friendly supplements on my website as well. But basically, the microbiome, it's all the bacteria that are in your gut that actually function as another organ. An organ that can create health or create disease. It's crazy because the way that they can help to treat the microbiome is with what they call fecal transplants, where they take the stool of a healthy animal or a healthy person. And I know it's not that great to think about that, but and if they take, let's say it's not a healthy person, but let's say it's an obese person, they found that if they transfer the stool from an obese person to another person who's not obese, the microbiome of that obese person starts to take over the microbiome of the non obese person, and they themselves become obese. I mean, I've even heard of some benefits with epilepsy and the microbiome. So it's an exciting new area. The microbiome in the mouth can solve a lot of the dental problems. Microbiome on the skin can help with a lot of the skin problems. So stay tuned on that topic because I want to get smart in that for you. And also maybe actually reach out and do a little local practice here in the Denver Boulder area. And then we want to be able to promote healthy organ function and organ reserves. And certainly diet does that. Using antioxidants is good. But there's also supplements. Also by eating some of the organ itself, there's something called glandular therapy, where if you eat, like let's say some liver, and it's a healthy liver, because liver can also store some toxins. It can help to support the liver because there's all kinds of micronutrients in those glandular in those pieces of organ that feed that the pieces of the healthy organ that feed the diseased organ. And then there's some herbs and things that also promote healthy organ function, such as milk thistle. The milk thistle, silymarin, can also actually help to promote a healthier liver and support the liver regeneration. So that's pretty cool. Training the immune system to work optimally, and that would be certainly, I would think, to use that through mushrooms. We can use that through herbs, but also, in terms of how you live your lifestyle. Stress itself is big in terms of how it reduces immune system function. So going back to what I was talking about, the emotional context, looking at that and trying to do what you can. And if you can't do it yourself, maybe you could reach out, to someone who could be helpful with you that way. Reducing inflammation through nutraceuticals, herbs, mushroom, and diet. We know some diets, are pro-inflammatory. Some diets are anti-inflammatory. Some diets, especially those that are high in carbohydrates or those that are ultra processed foods like our kibble, actually promote, promote inflammation, but also can promote can cause the microbiome to be less healthy. So these are all things we need to do. It seems like a lot, but I think if you start looking at the diet, looking at a healthy diet, adding some basic things to it, as I'll kind of point out, I've got a list of some of these here in a bit, but point out some of the things that are most important for doing that. I think you'll be in good shape. And the earlier you can start your pet on this kind of program, certainly, elderly dogs will benefit from it, but the younger they are to get started on, the better they will be, because it takes a lot of time for these strategies to really take root and to work well. Let's see what the next slide says. Right. So at this point, these are the supplements, and I don't really want to go into this part because I mean, I'm going to exactly, because I think that this is what I want to go into at the end when we talk. I want to talk about each of these supplements then. But I want this to be, again, I want this to be for you. I'm here for you, not you here for me. I'm not here to sell stuff. I'm here to instruct and help. So let's look at some questions and see if you can stump me. This kind of, for me, it's like Stump the Stars. It's like a game show, but not a game, of course. But and then Robin raised her hand.
Yeah, I didn't know if Robin had a question.
Yeah, Robin, do you want to unmute yourself and say something to us? I don't know. I can't see where you are on the gallery here. Maybe you're on another one. Let's see.
Here we go.
So I don't know.
I see the hand, but I didn't put it there.
Oh, sure.
Okay,
That
okay.
happens.
That's okay. But you can still say something if you want, as long as it's
Well,
nice.
this is my first time in one of your webinars, Dr. Rob, and we've been using your products for a long, long time. So
Thank you.
thank you for all you do. And I'm really honored to be here and hope to be at more of them. I
Well,
just, and I'll make this brief because
no, take your time.
I know you have a lot to do.
That's okay.
I just lost my 24 plus year old cat,
Oh my gosh.
Benny, in April. He died a natural death. He didn't have a lot of muscle loss and all this stuff.
Oh,
He didn't have to be euthanized. He had the most smoothest personality of any cat I've ever known. And I adopted him when he was 15.
okay.
And my cat Soldier is on my desk here. I adopted him when he was 14 and he's 20 now. And one of the things I've been doing is putting in my NutriBullet parsley, green zucchini, a little bit of celery, a little bit of kale, carrots, um, and I make what I call kitty salsa. It's a lot of greens, and I'll take a teaspoonful and I'll put it in their food every day. But I've noticed it's just fantastic for the urinary system. And um, you'd probably know what else, but there's so much we can do with those vegetables to make them available to our animals. NutriBullet is not an expensive thing. You don't need one of these
I have one of them.
$500.
Yeah, I have one of them too. Yeah. Hmm.
You, you got that?
Yeah, I have one too. Yeah, for my own smoothies. Yeah.
Yeah.
Yeah,
Um,
Robin, that's just great information, and obviously I was, before you told me what you're doing, I was going to say we must be doing something right to have your cats live as long as they do. I had one that lived for to be 21, and I felt quite proud at that. And he ate a prey diet. We fed him quail, and he and the other two cats did quite well, but he outlived them both. But yeah, the those greens are great, and I would, the problem with some cats is that they may not see that as being food. What was your secret to introducing them? And did you get them from very young kittens and started them right off then, or did you
no, they were seniors when I like I mentioned, Benny was um, 15 years old when I adopted him
Oh
from Humane
wow,
Rescue Alliance in
good for
Washington,
you.
D.C.
Yeah.
And Soldier, who's right here on the desk attending the webinar too,
Okay, so
just
taking
turned
notes.
20. I
Hmm.
adopted him also from HRA when he was 14.
Ah.
So,
And so what do you feed in addition to your
so I
green
do, and
purees?
this is also working with my vet,
Hmm.
Dr. Albano at Balance Veterinary,
Okay.
um, um, because they both had some different dietary needs. And well, that could be a topic for a whole other
Right.
webinar, the
Maybe when we do our diet
hyperthyroidism.
thing,
But
yeah.
so I used to give them fish and thing, but they both developed hyperthyroidism late in their lives, and
Okay.
so I have to stay away from the seafood. But I get human grade ground turkey, ground chicken, organic at
Hmm.
at the organic market near me. Um, it doesn't cost much more than cans of cat food. And my vet said, just for making sure that they have balanced vitamins, he told me put a little bit of canned cat food in. That's not going to hurt. Don't make that the main part of the meal. Organ meats, I get chicken hearts from the farmer's market, chicken livers,
Good
the,
for
the
you.
organic stuff, stick that in the NutriBullet, make an organ mixture.
Mm. Wow.
And
Very
and
creative. Hmm.
and I'm sure, I won't say I'm sure, I'm not sure, but I feel very strongly that this has a great deal to do with longevity.
I would agree with you. Now, do you add calcium to that mixture? Because
I
organ meat is
wish
very
I
high in,
knew. I wish I knew. And
but they did
maybe I
well.
can.
But they did well anyway. So I mean,
Yeah,
but still, we do recommend adding calcium, especially organ meat is higher in phosphorus, and phosphorus
right
is a
to the kidney.
mineral that we know can kind of stimulate the whole chronic kidney disease
Yes,
thing in
I
cats.
know. I
So,
know.
so
I'm
balancing,
very. I talked to my vet about that, so they get a very small amount of that
that's
uh,
okay.
in conjunction with other things.
Yeah.
uh, you know, I think it's important. Read everything you can, everybody. If you're not already doing that, work with your vet and see what flavors
Mm.
what your dogs and cats love,
Yeah.
and go
Well,
from there.
Well, thank you, Robin. That's a great contribution. I just wanted to add that seafood really has not been seen to be a cause for hyperthyroidism, but canned food has been. There's a lining in canned food called BPA, and
Yeah.
the
So
BPA.
I'm sorry. Go ahead.
It's okay. Go ahead. No,
No, you go ahead.
this is your time. The BPA is what we call an endocrine disruptor, and it's
Right.
similar to DES. We know how DES, the early use of DES in women created problems in their offspring. And the BPA actually alters hormones. It's an endocrine disruptor because it looks like a hormone to the body, even though it's a plastic type of thing. And so that's what we have. There's several large studies, one in UK, one in the US of like 20,000 cats that epidemiologically determined that it was the canned cat food, the BPA, that did that. A small amount, like you were doing, not a bad thing. But one of my cats, like I mentioned, I was feeding my cats a prey diet, which was quail. But we had a big flood here in Colorado, which knocked our power out for really a couple of months before we were able to get the freezer to work again to keep those quail.
Wow.
And so I fed all three of them canned food because it was convenient, especially without refrigeration. And one of the three developed hyperthyroidism, and they say there's about a 30% incidence, which was interesting because I had three cats. So just a word to the wise, but that was great. Why don't we and thank you so much for contributing.
Yes.
Like I said, we're
And I
here.
just one more thing, and then
Okay, go ahead.
I'm careful to get the cat food that is in the BPA free cans.
Right. I'm a little bit concerned though that they've gone from BPA to BPB.
Uh,
'Cause I'm not a conspiracy theorist,
no,
but I
thank you very
but
much
I
for
think
this information.
the profit motive can oftentimes cause people to do things or companies to do things that are a little bit, not exactly honest. But I have seen that they are making some cat food that comes in pouches and other ways as well. But
But
again,
then you got the microplastics.
well, yeah, but then again, small amounts, is not going to be a big deal as compared to just feeding that entirely each time. So.
Okay, thank you
Yeah.
so much
Oh
for
yeah.
that.
No, thank you. And like I said, don't worry about taking up too much time. We're here, we're gonna bop until we drop. So let's take the next question.
Yeah, so first question here. So we have which mushrooms in what amounts should be given to a 9-year-old spayed female GSD mix with suspected degenerative myopathy?
Okay, so GSD is German Shepherd dog, which has a high rate of developing this degenerative myelopathy, which turns out to be very much like an ALS kind of condition. It's considered to be a model for ALS, which is Lou Gehrig's disease, which is a progressive paralysis that affects you. And so it's a problem. And I'm not sure there is, I'm sorry, but I'm not sure there is a good solution to it. However, if you can catch it early enough, which is what you have the best chance of some kind of success, then I would, look to using a mushroom combination, but also one that might affect the nervous system. So looking at something like lion's mane would be a very good mushroom because it has a direct effect on the nervous system, and it also has the same benefit that all mushrooms have in terms of improving immune system function. We don't really quite understand what causes it. I'm sure there's a genetic component since we see larger amounts of it in certain breeds of dogs. But I would recommend something like lion's mane to begin with, possibly adding turkey tail to that. There may be an infectious or a viral component that stimulates it that we're also not aware of, and maybe Lyme's disease, those sorts of things. And if we're talking about the real mushrooms products, that's a large dog. I would assume maybe 60 to 75 to 85 pounds for that dog. I would, start low, as we always want to do, because some dogs will have allergies to mushrooms or just react to them in ways that we don't, that if you give them a large amount to begin with, they might react to it. But if you start with a small amount, and work way up gradually, they wouldn't. And so I would work my way up to at least a half a teaspoon of the powder of each of these mushrooms twice daily, and possibly even work your way up to a full teaspoon. Mushrooms are extremely safe, and it's the sort of deal where the larger the dosage you give, the stronger the effect. I don't know that they're going to work. There has been some evidence that cannabis itself has been helpful with ALS patients, or at least slowing down the progression. That's cannabis that also contains THC, which can be difficult to increase the dosage in a dog because of their sensitivity. My book does have an explanation of how to introduce THC to your dog, and THC is, of course, still federally illegal, legal in some states. So I don't want to be giving you advice that's, counter to your local laws and regulations or counter to federal laws and regulations. But there is information in the book about that as well. I'm sorry that your dog has it. It was a very frustrating treatment for me in clinic. I used to, and you might also want to look at acupuncture and particularly electroacupuncture that I would use. I would put needles down the back and hook electricity up to it to try to increase the strength of that treatment. Um, there you go.
So next question here, what can we do to help our senior dog, 18 years old, with sundowners, pacing, and barking all night?
Well, don't want to sound like a broken record, but lion's mane has been shown anecdotally, and there is a recent study with a lion's mane tincture, in fact, that has some herbs in it as well, that does show some benefit for this condition. Now, there's different levels of sundowners, and some may be so severe that nothing can touch it. I think Ollie's got a little bit of that as well. He gets kind of restless. He does a lot of panting at night, although he can still find his food bowl. So I would suggest lion's mane. And we have some good anecdotal evidence that it could be helpful. It contains three different ingredients, all of which could help with cognition and mentation. There's studies in laboratory animals, and there's studies in humans who have dementia, because sundowners is a form of senile dementia in the dog, that show a benefit mostly with early forms of dementia. Um, but I would go ahead and give it a try. There's other things you can do as well, other than mushrooms, like fish oil could be very helpful for the brain, as can B vitamins to be, just as a few things to consider. Like the B complex is what I would recommend, like a stress formula.
So I do have a couple of questions here about Cushing's in particular. What would be your recommendations for a dog with Cushing's?
Cushing's is a very complicated problem, and I have had quite a bit of experience treating it in the dog, um, but I haven't had really good success using complementary therapies for it. They've developed a drug for Cushing, so a lot of it depends on how severe it is in your dog. If it's really debilitating and disabling them, you might want to go at least to the pharmaceutical to begin with. It's called trilostane. In order to get them back to a normal place, and then you could start, using the supplements as well. But I did a study in horses. Horses get Cushing's as well. I don't think we've identified it in the cat, but horses get a form of Cushing's as well. And I did a study with a couple of equine vets using cordyceps mushroom in these horses that had Cushing's, because cordyceps is an adaptogen, and adaptogens address the pituitary adrenal axis. And that's what Cushing's is all about. Most of the canine Cushing's that we see, although it's an adrenal gland problem, pointing to my adrenal glands, it really starts up here in the pituitary gland. And there's usually a little nodule on the pituitary gland that causes an excessive amount of a hormone that stimulates the adrenal glands. So horses get the same thing, only it's a little different variation. We gave a large dosage of cordyceps mushroom to these horses for 4 months. And we measured insulin levels and ACTH levels. And horses that have Cushing's, they get this shaggy hair coat, and it's a precursor to get laminitis, which is a painful, oftentimes a reason to terminate the horse because it's so painful in the hoof. And we got success with that. So I haven't had the opportunity to have enough Cushing's patients to try the cordyceps with. So I would strongly encourage that you try it. I'd love you to reach out to me so maybe I can track the course and give you direct advice for your animal in terms of dosing it specifically, that sort of thing. We do carry cordyceps in the pouch on our website, and it's a very tasty mushroom. It's my favorite mushroom. I take a lot of it. I think it tastes a little bit like um, toast. It's got a very lovely taste, little buttery toast. And I take it in my tea and I mix it with some lion's mane. It's a great tea. So that makes it very easy to start with a small dose in their food and gradually ramp it up based on their weight and based on trying to get as much in them as you can, as your budget can afford, and as much as they would accept. But I wouldn't expect an immediate resolution. And if they are really severe, it may be better to try the drug, get them less severe, and you can certainly use the lion's mane at the same time, but then maybe see if we can taper down the drug and just let the lion's mane take over.
All right, next question here. I would like to know how to address my apologies if I mispronounce, seborrhea.
Okay, yeah.
Um,
Seborrhea, an oily skin problem.
yes, and hyperkeratosis. Also, low T3 thyroid.
Okay, well, that's a good question. And I think that, maybe looking at the thyroid first would be the thing to do. Thyroid governs the skin. Most of the thyroid patients, the hypothyroid patients that I've seen, have seborrhea, and they can get that hyperkeratosis as well. Or that could be another kind of disease. I mean, skin problems aren't simple. They can be quite complicated, but usually they are an external reflection of something that's internally off balance. And the thyroid testing needs to be fairly comprehensive. You can't just base it on a T3 or a T4 because in the dog, and it's different than in the dog than in the person, you need to look at different parameters within the thyroid complex. And so you need to spend some money to do a fairly, comprehensive thyroid test that would have T3, T4, free T4, and also autoantibodies because you can get a problem with the thyroid gland that's an autoimmune problem with the thyroid gland, which actually makes them not test that bad unless you do those autoantibodies. And then supplementing with the thyroid hormone, I don't feel that that's a bad thing. I mean, some people are like, oh, no pharmaceuticals at all. I think we need to look at, the quality of life of the animal, not just measuring it against your own philosophy, but what's right for the pet itself. We don't want them to suffer. And the thyroid hormone can be very well regulated by doing what we call post-pill testing, which means after you give it for a while, you then draw blood at the time when the thyroid hormone might be at its peak or at its trough, and that lets us know how well it's working. You could decrease it to make it lower, but still effective and safe, or increase it if it's not effective enough. They also have available some whole thyroid, desiccated thyroid, which can also work as well. It's a little, and you can also use the same thyroid testing for that if that's a path that you would rather travel. But I think, your mention of the thyroid just makes me think that. Now, the skin problems can be very complicated. There can be some genetic predisposition to that. Diet can play a role. And the seborrhea, it's stinky. The oily skin allows the development of secondary bacterial infections, which makes it even worse. And then the bacterial infection makes the skin secrete more oil to kind of get rid of the bacteria. So, it's a complicated issue, and I don't know that I can solve it just by telling you, what mushroom to take. Now, the one mushroom that we think about when we think about the skin most certainly is called tremella. And I haven't really talked much about tremella. It's an interesting mushroom. It's a prized edible mushroom in Asia. It's a jelly mushroom. But tremella has a high concentration at the skin and it helps to hydrate and moisturize the skin and helps to improve its health. So I think there's more information that we need before we just say, yeah, go try tremella. I'm sure that'll fix it because I don't know that it would. And I'm sorry I can't give you, an answer that's going to fix it. But I think it's a place to start. And I think mushrooms in general would be beneficial, even if you can't. And we're now carrying tremolo. I think we just added it on, didn't we, Haley, to
Yep.
our
I
website?
did put a link in
Um,
the chat to it if
yeah, yeah.
you want to check it out.
And certainly it's a place to start. It's very tasty. It's the blandest mushroom there is. So it goes very well with the food. I would probably combine it with something like cordyceps, or reishi, um, just because I think we need a little more oomph, in terms of some of the other qualities that mushrooms have. But again, I would check that thyroid thing out. Might be curative.
So next question here, is there anything we can do for teeth that would help preserve them? I have brushed my dog's teeth his whole life, but now that he's 12 years old, he has lost quite a few. Would rubbing a probiotic after brushing help or any suggestions?
Well, I think there are some new strategies for addressing chronic periodontal disease, which is what you're describing. That's where it's good that you were brushing the teeth, but they're not easy to brush their teeth. And I don't know if you can do as thorough a job as we can with ourselves. There is, and as I was mentioning with the microbiome, there is actually an oral microbiome as well. So there's some strategies looking at that. We know there are some bacteria in the mouth that promote periodontal disease and dental disease, just as there's, blends of bacteria in the mouth that don't. I've just gotten in the mail today, because we have some periodontal disease in my family as well. My two Maine Coon cats, they have gingivitis and periodontal disease as a kind of a genetic trait. Our little kitten, Spencer, had gingivitis even at 6 months of age. And so I've been hearing very positive things about this product, and we're looking to carry it on our website or offer an affiliate for it. It's called TEEF, TEEF, and it's a liquid you put in the water. Well, it's a powder you mix in the food. And I'm going to just get started. I'll let you know how it works, but I've heard very good things about it. And what it does is it's like a prebiotic specifically for the good bugs in the mouth. And it's worth a try. I didn't think it was that expensive, and it's easy to eat, easy to administer. But also, as much as we hate putting our pets under anesthesia, regular dental care does help. Now, I know veterinarians have gotten really expensive since the pandemic. We're looking at getting Spencer's teeth. He's already had one teeth cleaning, and we're looking at another. It's going to cost us like $1,000. That's a lot of money, you know. But he's going under anesthesia. There has to be monitoring of that. He actually also has genetically a hole in his heart, so there's that concern, you know. So starting early is the best solution, of course, for everything. And looking at some of these new approaches that we have to work with the oral microbiome, I think would be a solution. There's also some evidence that seaweed, and there's some products that contain seaweed for the mouth. Seaweed can also help to break down the biofilm, because it's the biofilm in the mouth that entraps these bacteria in the gingiva and underneath the gum that then allows them to do their damage and to create this inflammation. Now, I think mushrooms in general, as a part of their daily regimen, have a natural anti-inflammatory and antimicrobial effect. They help the immune system to work better. They can help to adjust the gut microbiome, which is definitely related to the oral microbiome because they're all part of the same tube. So, I would say I think giving a mushroom regularly, not just because I sell them and I work for the company, but I believe strongly in their value would also be good. And I think any mushroom would be fine. If your pet has another problem as well, we would find a mushroom that might address that. Our Five Defenders, which has five mushrooms in it, or our Daily Dog, which has the five mushrooms plus lion's mane and cordyceps, plus a really good probiotic in it, would also be a good addition to your pet's regimen on a daily basis. The earlier you start it, the better effect it will have.
So next question here. I give my dogs 5 defenders once daily, and 2 pups get the mushroom relax, and one will be doing mushroom mobility. Is this okay, or is this too many mushroom supplements?
I'm always curious when people are asking about too many. Really mushrooms are safe at really high dosages. So it's not a matter of being not safe. Mushrooms have not been shown to interfere with drugs nor with other supplements. Some pets may have sensitivities to mushrooms, which might be a reason to not use as much. But I would not worry about the too much from getting the five defenders plus the mushrooms that are in the soft chews as well. Personally, I take a lot of mushrooms. I take, 12 grams of mushrooms a day, if I can have the time to take them all. So I wouldn't worry about that. I think that you're doing good. I think the Five Defenders is a great product. It's the most popular product that Real Mushrooms makes. Humans use it a lot and talk about all the benefits they receive, so we know it works well. So it's a good general wellness mushroom, and that's one reason why we also put it in the daily dog and the functional feline.
So, are giving the supplements, such as mushrooms, in a piece of meat just as effective as opening them and putting them spread out in food?
Absolutely.
Um, I worry about the capsule not being absorbed as well, especially in a small dog.
I don't think there's any problem with opening the capsule. You can also look at the powders that we have, which eliminate the capsule entirely. Capsule helps to keep the mushroom from tasting in a bad way that your pet won't like it. But then again, the giving by capsule is also an issue in terms of acceptance by the animal. So no, I think if you want to open it and sprinkle it in the meat, if you want to just hide the capsule in some meat, or there's other ways of giving it as well. I like, sometimes Ollie, my own dog, he's pretty clever. He hates me giving anything. I mean, he's like the worst vet's dog there is in that regards because I want to give him a lot of stuff. So when I put it in meat, oftentimes he's able to find the capsule and just spit it out and eat the meat. So I like to use things that are sticky, because that way he can't really separate it. So like cream cheese, or peanut butter. And another trick, and maybe you're not having this problem, but I like to give my little clinical tricks here. But another way is to have another piece of meat or treat or something so that when you give the first one in the meat, you then have that available so they have barely swallowed the capsule in the meat and they're ready to take that second treat. So they just get it right down and don't have the time to feel it and spit it out. But no, there's no problem with what you're doing. It's great. Keep it up. Just, the giving it regularly, however you get it in there, that's the key.
All right, next question here. I keep seeing social ads from the company Loyal on a longevity pill coming next year. Can you give any insight into this pill? Legit or a marketing scam?
Well, I think that the pill you're talking about is rapamycin. And rapamycin is a drug that is considered to be a longevity drug. I know some humans that are taking it. Um, and it's interesting, again, the fact that, and it's not that cheap a drug. And I think it's interesting to see how important this whole longevity concept has gotten, that there's a company that's actually getting FDA approval for this drug in dogs. Now, dogs live a long time. How are we going to really know that? When they test these drugs, they test them in animals that don't live very long. Like there's a nematode called C. elegans, or fruit flies or mice, don't live that long either. So we can follow the lifespan and see how they live. Dogs live a long time, so I'm not quite sure how they're going to prove that and have that be a legitimate medical claim that the FDA backs up. But I guess if they're spending a couple $100 million to get it approved, they're expecting it to sell well. Now, what it does is rapamycin inhibits an enzyme in the body that promotes aging. It's called mTOR, mTOR. Now, one of the things I found in my research into my favorite mushroom, the cordyceps mushroom, is that the one of the active ingredients in cordyceps is a very unique molecule called cordycepin, named after the mushroom, of course. Cordycepin at high dosages also inhibits mTOR, just like rapamycin does. This is why I really promote mushrooms for longevity because they have that kind of benefit. And cordyceps, as again, favorite mushroom, has that ability with the cordycepin to inhibit mTOR, just like probably this expensive drug will. But it also is an adaptogen, which means it helps the body to adapt to stress. This is the same mushroom I talked about that helps with the pituitary gland and the adrenal glands. Well, the adrenal glands are your stress organ. And so cordyceps helps your body to better manage the incoming stressors. It's that's what an adaptogen is. And it's tasty and it's so yeah, so cordyceps is what I would suggest. But yeah, I have heard of that and I don't think it's just hype, but I just I think there's, as I mentioned, I think it's not a drug. There's no magic pill for longevity. It's lifestyle, it's health span. That's really what you want to look at.
So next question here, are there any herbs we shouldn't use with mushrooms?
No, I can't think of any. I think herbs and mushrooms are like the perfect cocktail. They work together synergistically. Using a mushroom with another immune modulating herb, like in Chinese medicine, we see a lot of combinations of mushrooms with astragalus root, which is a major Chinese herb that enhance the effectiveness of each. So no, I don't think there's any herb you can't. And I take a lot of herbs. I'm an herbalist. I have mushroom tea every day, and I take that reishi, which is way bitter. Reishi, by the way, is also an adaptogen, but because of its taste, I don't think it's a powder that can be easily given to animals like the cordyceps. That's why why we have reishi in capsules on our website. But what I do when I have my reishi in my tea is I put ginger root in there. And ginger root really tempers that bitterness, of the reishi. That's just kind of a tip for people if you wanted to try drinking your mushrooms instead of taking them as capsules. Go ahead. Next one.
So
How are
I'm
we doing, by the
extreme.
way? Do we still have quite a few questions? I'm not.
Let's see. I think I have two or three more here.
Okay. Well, we're doing good. We're only at the hour mark.
Yeah, and then once I read this one, I'll be sure to put that discount code in the chat too for
Okay, sounds good.
just so you have it, just so you have it. So, I'm extremely worried about the proposed hemp ban bill that is seeking to criminalize hemp products. I've written to all my local Congress members urging them to vote no. Your CBD oil has been a huge help in keeping Bruce Wayne's focal seizures at bay. Just wondering your thoughts and what is the shelf life on the organic silver bullet in case we need to stock up on it.
Well, the organic silver bullet's really got a 2-year shelf life, and it is becoming more popular. So we're also remanufacturing it much more frequently. We did a run of like 500, I think, in June, and we're just doing another 500 now. So, I don't really want to talk about government. I think it's a problem these days, and everyone has their own special opinion, which I respect. And I am also concerned about this. And so, yes, if you need to stock up on it, and I'm not quite sure how that affects, shipping it through the mail versus whether it's sold retail, in each local state. I haven't looked into the details, of that bill. I know there are already states that ban CBD, like Idaho, for instance, bans CBD. And I don't understand because many of these states would benefit from growing hemp for so many reasons, not necessarily for extracting the CBD, but as animal bedding, as animal feed. Hemp is high in protein. It's a great feed for livestock. The only downside is the FDA, USDA actually worries about CBD in animal, in animal food products, in the human food chain. But CBD has really shown itself to be quite safe. But yeah, that's unfortunate, and it's nice to see Bruce Wayne here because we also get to meet Bruce Wayne at the Real Mushrooms Q&A as well. You're always there.
All right, next question. What recommendations do you have for osteoarthritis in a 4-year-old dog?
It's pretty early. Um, Certainly, curious, how it developed. Is this an athletic dog? Was there trauma? Did it just occur? Was it born with bad hips? Those kinds of things. But it's pretty early to see it like that, and there may be some other exacerbating causes for it. But the single best treatment that I have found for osteoarthritis is not a supplement. It's actually a drug that you give by injection. But the drug, it's FDA approved, and you have to get it through your vet, which some of them are reluctant to do it. And it is something that's very safe. It's easy to give at home yourself by injection. And it's called Adequan, Adequan. And basically it's liquid glucosamine. And so oftentimes I think there are issues with the absorption of things like glucosamine and chondroitin sulfate, other whole food approaches to arthritis include green-lipped mussel and deer antler or elk antler. These contain a lot of these molecules that feed the joint and that help to provide increased lubricity to the joint fluid. And then, of course, reducing inflammation in the body as a whole, looking at diet, looking at activity, looking at weight. Ollie, I spoiled Ollie. He got really heavy, and he couldn't get up into my truck anymore. Put him on a starvation diet, literally gave him half the calories that he's supposed to get, and he's doing great. So weight loss is probably the single best thing you can do, and sometimes even getting them to be a little bit on the thin side. Your neighbors might say, "Are you feeding that dog?" But could be much better for their mobility and for the pain that they're experiencing. I think the use of NSAIDs, the use of drugs for that, is better short term. If your dog is already arthritic and does something that causes it to flare up and it's more painful, using a drug like that short term, just like you might take a little Advil or something for a headache or a quick sprain. But I think it's more the long-term approach. Now, acupuncture is great for arthritis. There's Chinese herbs, there's Western herbs, Ayurvedic herbs, the herb Boswellia. I have a mobility product. I'm not trying to downplay it, but I just want to give you the whole picture because that's what integrative medicine is. It's looking at the good stuff from conventional medicine, looking at the good stuff from, a holistic medicine, and finding the best blend that's for your animal, not necessarily for all animals. And so, there's turmeric. We mentioned turmeric before, and especially if you use a highly bioavailable form of turmeric, or if you use larger amounts of the culinary herb, blend that with the boswellia. The two together work really well. Don't want to forget CBD. CBD in some animals can work really well, but there are other animals that I've heard of that the CBD just doesn't work well enough. But at the same time, many people don't dose the CBD high enough. I hear people with dogs that are 50 pounds are getting 2 or 3 drops of it. Oh, it's not working. Well, I wonder why. So you have to dose the CBD based on the weight as well. And I think I've got good guidance for that. CBD is best absorbed, which gets the best blood levels, which gives it the best effect if you give it with food. And that makes it easier to give too, especially if you give it with something that's a fatty food, because they've discovered that if you give CBD with fatty food, it bypasses the liver, which is going to completely metabolize it, so you don't have any CBD in your blood, and it will build up in your blood better. So that's what I recommend with the CBD is start low, give it with a small amount of food before meals, and then give it a couple of weeks to build up in the body because maybe the low dose would work, especially with improving blood levels by giving it the food, and then start to increase the dosage. And we can give really high dosages safely, limited really mostly by your budget and the acceptance of your animal. So that's something to think about as well. So the chondroprotective agents like green-lip mussel and deer antler, the anti-inflammatory herbs, an anti-inflammatory diet, looking at lifestyle, looking at weight, looking at acupuncture, looking at herbs, all that. It's a multifactorial approach. We call this a multimodal approach to pain or to arthritis, which means no one thing is enough to do the job. You have to use a blend.
So this question here is a follow-up to the seborrhea hyperkeratosis low T3
Okay,
question
sure.
from before. So I did have this is her, have a complete thyroid test done through Michigan State, had a hair analysis done, low in zinc on that hair analysis, have her on 0.55 milligrams thyro tab 2 times a day, 12 hours apart on an empty
Okay,
stomach.
good.
I just received the results from her thyroid test. She is absorbing T4 well, however, her T3 is low. I am wondering if maybe an RX like Armor would help. Any thoughts?
Well, Armor is the whole desiccated thyroid and does actually have. So if you're using something like Thyrotabs or one of the commercial products for pets, that is just a T4. I agree with you. And it may be that in your animal, you're not getting the. And thank you for the extra information. And I think, even though I spouted about it, I think it was good information for everybody else, even though obviously not adapted to your animal specifically. But yeah, I think thyroid tabs, I think Armor's thyroid or Westroid. Those are the two products that I've thought of that I've used clinically that can be very helpful for that. I don't know if this product is still available, but I used to be able to get like a whole dried thyroid in capsules from some company. But yeah, I think that's a good idea. I'm not sure where you get that stuff anymore. I'm not in clinical practice, so I don't have as much hands-on for those pharmaceuticals, but I think, that there may in fact be a conversion problem there. You said zinc was low, and zinc has been shown in studies to have an low zinc to have an adverse effect on the skin. I also wonder about iodine. What's your if your mineral and was that um, a mineral test of the hair? But I was wondering, excuse me, if I was wondering if that was what the iodine was as well, because you might want to look at adding some seaweed, which would be a natural source of iodine, but also has some overall benefits to the body's health and skin.
All right.
We
So,
didn't
what?
talk about diet, and diet can also be a big concern there too. And there could be allergies, food allergies that could also be part of this picture. And so if you want to figure out what that is, then there are some testing that I recommend for that as well.
All right. Next question here. What dosage of cordyceps would be optimum for two senior golden retrievers? One is a 10-year-old neutered male, 68 pounds. The other is an 8-year-old female, 53 pounds.
So they're pretty similar at weight, and you're not really telling me what you're treating. So, because we would increase the dosage with greater need, but wouldn't need to do it so high. So generally, a rule of thumb that I'm using is about an eighth of a teaspoon per 10 pounds of body weight per day. Um, and for more severe conditions, twice daily. So let's say 50, 60 pounds. That would be, about a half of a teaspoon to three-quarters of a teaspoon or so daily. You could divide that into two feedings. You could see how that works, and again, I don't know what you're, using it for. And you could give that twice daily as well. And again, mushrooms are safe at any speed. And if your budget and your Goldens can handle it, I'd probably go half a teaspoon to a teaspoon twice daily for them.
All right. Another question here. What would you give an older dog to support eyes if they are getting cloudy eyes?
Hmm. Well, the cloudy eyes, as an aging change, we call it lenticular sclerosis, and the lenses themselves look cloudy, but it's not cataracts. They can still read the fine print. They can still drive, and they can still see at night. Um, but it is an aging change, and it is a sign of oxidation, of those eyes. And I don't really have a handle on a specific mushroom for ophthalmic issues. I think any mushroom will function as an antioxidant and would function as an anti-inflammatory. There are some formulas in Chinese medicine that use chrysanthemum flowers, which go to the eyes, and and in Chinese medicine, the liver is considered to open to the eyes. So looking at formulas that could possibly help with that. But I don't have a specific remedy for that other than everything I've described as far as, reducing inflammation through diet and supplements, fish oil and things like that. But I wouldn't worry about it. I mean, what do I know? I can't see those eyes, so I don't really know. I'm assuming, that it is what I described. But it's hard. So it can be sometimes hard to look at, but not necessarily that much of a clinical problem.
So, wondering about the product ergothioneine, would it be okay if a dog is taking a few other supplements? An older dog with a few issues is taking a few other supplements, but he does want to add that ergothioneine. Do you have
The
thoughts on that?
ergo is again like it's a part of mushrooms. It's found in food. It's a very safe antioxidant to use. I don't think there's any there's been no studies that show that it's unsafe at higher dosages or that it interacts or interferes with other things you're giving. Now, the ergo, it's a good product. I take it myself. And it's it'd be good for many of us who are watching this who might be experiencing some senior memory issues. But what's interesting is that all mushrooms contain ergo. So really almost any mushroom would work, but in particular, our friend lion's mane, in addition to having the terpenes in it that also help with neurologic and brain function, is also a good source of ergo. So you would be getting ergo with your lion's mane as well, and I wouldn't really see the need to duplicate. If you're taking one, don't necessarily take the other. If you're giving your pet one versus the other, I like the concept really of the lion's mane having so much in it because it has the ergo, it's got the hericenones, the terpenes, plus it has the beta glucans and it has other flavonoids and antioxidants. So that's why I mean I like mushrooms because they have so much in them. They're the Swiss Army knife, of supplements, and they're very safe to use and very easy to give.
So, would hot water bottle heated blanket, not help a young dog with osteoarthritis? It helped my human OA teenage onset.
Okay. Well, both heat and cold can be used to help with arthritis. And certainly for an old fart like me, I find in the mornings I'm pretty stiff and painful from my chronic osteoarthritis that I have just from life and sports. And that if I can warm myself up, I move better. At the same time, if there's an injury, if I sprain something, for instance, that maybe there's arthritis underlying that as well, causing the arthritis to flare up, then using some cold therapy can be helpful, specifically if it's on an injured joint. But in general, I think the heat is a better strategy if it works for your dog. Some animals, some people run hot, some animals or some people run cold. And it might be, if your animal runs hot, that using a warm blanket might be too hot for it. So it is very individual, but I think the warmth, especially in the morning until they warm up, is not a bad idea at all. I definitely support that.
So, what mushroom would be helpful for stress and or anxiety in dogs?
Our favorite, I guess I'm sounding like a broken record here, but lion's mane is what I would recommend for both of those. Um, because of the ergo that it contains, because of the terpenes that it contains, we have seen benefits with it as well. Now, you could combine the lion's mane with well, there's another mushroom called reishi, and reishi actually has these terpenes in it that go to the brain and stimulate the serotonin receptor. That's one reason why I put the reishi together with the lion's mane in my mushroom relaxed chews. Um, but also CBD, combining, that's kind of an area that I'm becoming more expert on, which is combining the two. There's synergy between the CBD and the mushrooms, especially around anxiety, because there's some studies that show that mushrooms also signal those same serotonin receptors. And serotonin um, is the vegetative, it's the relaxing neurotransmitter. You can stimulate more serotonin production by taking the amino acid tryptophan. That's where we talk about, turkey dinner or drinking warm milk before bed helps to increase the tryptophan in your body. And so does CBD, and so does reishi, and so does lion's mane. So, it may be that, for reducing anxiety and reducing those things, those would be good supplements. But remember that there's triggers to the anxiety. There's lifestyle, there's all sorts of things going on. There's no magic bullet to treat anxiety. These are good techniques to kind of lower the pressure a little bit, but you need to kind of look at what's going on. What are the triggers for the anxiety? Maybe this is a dog that came from a rescue operation. Maybe it's a dog that has